Here's some key things to think about if you're getting persistent knee swelling after a cleanup, after OA, after a surgery, after an ACL reco. The first thing I want to share is time. Any surgery takes a good 2 to 3 years for your body to fully recover. And I think at the time we don't fully get the gravity of having an invasive surgery. But we know that bone healing can take 12 to 24 months. So anything where they're going in, cleaning up, scraping, that can take a really long time for your body to recover, particularly if you're quite active on it early, which is a good thing, but it just takes a little bit longer. The second thing is when you weigh up that time, that length of time, are we doing consistent, graded and guided rehab? So constantly getting our knees stronger, having a very thorough physio review, your strength program for your knees, your quads, your hammies, your glutes, and slowly progressing that, but also progressing your plyometrics, your ability to step, to land and jump, and do that with weight. A lot of people we see only get to like very basic squats or very basic step ups. They've actually never loaded their knee in a graded way, considering running and stepping and considering jumping and doing that with weight. Because when you do that with weight, your body adapts to that, and then doing it without weight, it's much easier for your knee to handle. Third thing to remember is that when you are getting those flare-ups and swelling, you're not necessarily damaging your knee. We see a lot of patients that say, I was getting flare-ups and swelling, so I assumed that was bad for my knee, so I stopped doing the rehab. It is a sign that your body's not quite ready for that, but you're not doing any further damage. And it's actually really good to nudge into that every now and then to know your limits, then pull back a percentage or two, stay at that level, stay at those exercises, stay at that weight for a while, and then bump back up and see if you can progress without a flare-up. How to manage that swelling is, I found a wonderful unit called Game Ready. You could look that up, and there's lookalikes as well. It's compression and icing on your knee. Now, I used to do that before and after gym sessions and before and after I played. And I've had an ACL reco, and I was getting persistent swelling for a good 2 to 3 years after. And it wasn't until I doubled down on my strength training and really took my rehab super seriously and progressed it in functional ways like stepping and like landing that I stopped getting that swelling. Now, occasionally, I'm 10 years after my ACL op, it still does swell. And what's really interesting, it's when I back off on my gym program. So be patient, hang in there, have a really good physio review your program. If you need help with this, we do online consults. We can help people all over the world with their programming, and we're happy to do live consults if you're in Sydney, Australia.